Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies. And then the last question is, what can you do long term? Because people have heard stories about the knees wearing out, and if you do too much, then you'll need more surgery later on. Well, the good news is that the manufacturing techniques have gotten so good now that we expect most artificial knees to last 15, 20, or 30 years even in terms of wear and tear of the plastic. There are other reasons that knees can go bad, like infection or coming loose or breaking the bone, but those are very infrequent. The big issue in terms of longevity is the plastic wearing out. And like I said, we don't worry about that as much anymore. So I tell people, go back to doing what you feel comfortable doing. You will figure out what you can and can't do. For example, I have patients who can jump out of helicopters and ski after their knee replacements. I have patients who are snowboarding. I have patients who are surfing. I have a championship weightlifter who can, dead squat over 400 pounds. That's not to say that you'll get back to that sort of activity, but I would encourage you and all my patients basically to figure out what it is you can and can't do and get back to an enjoyable lifestyle, because that's the reason you had the operation to begin with.